Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bonjour à toutes et à tous. Pour freiner la propagation de COVID-19 au Nouveau-Brunswick, nous avons dû prendre de nouvelles mesures et imposer de nouvelles restrictions aux interactions publiques. La semaine dernière, la santé publique a recommandé que les zones 1 et 2 passent à la phase d'alerte orange du plan de rétablissement. Aujourd'hui, nous avons recommandé au cabinet que la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, passe également à la phase d'alerte orange à compter de minuit ce soir. Arresting the spread of COVID-19 in New Brunswick has required us to take new measures and impose new restrictions on public interactions. Last week, Public Health recommended that Zone 1 and Zone 2 move to the orange phase of recovery. Today, Public Health has recommended to Cabinet that Zone 3, the Fredericton and Central New Brunswick region, also move to the orange phase. This will take effect at midnight tonight. We are taking this action because of the course that the virus is taking in this area. We have seen multiple cases emerging in a variety of settings, including schools, pubs, health facilities, and a large number of contacts have been identified. We are seeing cases resulting from large gatherings and social interactions, as we have seen in Zone 1 and Zone 2. I am also concerned about the level of interaction among people living in the Fredericton, Moncton, and St. John regions, which is contributing to the overall rise in cases. This change requires people living in Zone 3 to restrict their close contacts to a single household bubble, which may include the immediate family member or caregiver as required. Wearing a face mask in public places is mandatory outside and inside. Most businesses can continue to operate according to their COVID-19 operational plans. Les restrictions de la phase orange sont maintenant en place dans plus de la moitié de la province. Pour éviter que cette situation se répande au reste du Nouveau-Brunswick, nous devons travailler ensemble dès que maintenant. Today, there are 12 new cases of COVID-19 in the province. In Zone 2, which is the St. John, Kings, and Charlotte counties, there are 8 new cases. 1 individual under the age of 19, 1 aged 20 to 29, 3 individuals aged 40 to 49, 1 individual aged 60 to 69, 1 individual aged 80 to 89, and 1 individual over 90 years of age. In Zone 3, which is the Fredericton and Central New Brunswick zone, there are 3 new cases. 2 individuals under the age of 19, 1 individual aged 20 to 29. In Zone 1, which is Moncton and Southeast New Brunswick, there is 1 new case in an individual aged 20 to 29. There are now 105 active cases of COVID-19 in the province, including 1 person in hospital. Zone 1 and Zone 2 remain at the orange phase. Aujourd'hui, il y a 12 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de St. John, Kings et Charlotte, il y a 8 nouveaux cas. Une personne de moins de 19 ans, une personne âgée de 20 à 29 ans, 3 personnes âgées de 40 à 49 ans, une personne âgée de 60 à 69 ans, une personne âgée de 80 à 89 ans et une personne âgée de plus de 90 ans. Dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick, il y a 3 nouveaux cas, 2 personnes âgées de moins de 19 ans, une personne âgée de 20 à 29 ans. Dans la zone 1, soit la région de Moncton et le sud-est du Nouveau-Brunswick, il y a un nouveau cas à signaler, soit une personne âgée de 20 à 29 ans. Il y a présentement 105 cas actifs de COVID-19 dans la province, dont une personne qui est hospitalisée. It has become increasingly clear in recent days that the rise of COVID-19 cases in New Brunswick has been fueled by young adults, especially those between ages of 18 and 30. And this is what we have seen in the outbreak and the community transmission in the Halifax area. As I mentioned earlier this week, New Brunswickers under the age of 30 now make up more than half of the active cases of COVID-19 in the province. We are particularly worried about how this is spreading among the youth in New Brunswick. And so to reverse the trend of rising case numbers, it is vitally important that young people do three things: stop gathering in large groups, stop traveling, especially to known hotspots in our region, and get tested as soon as symptoms emerge. And we know that in this population, symptoms may be non-existent or very mild. And we also know that the period of contagiousness does occur prior to symptom onset. So it is very, very important to follow public health advice. Il est devenu de plus en plus évident au cours des derniers jours que l'augmentation du nombre de cas de COVID-19 au Nouveau-Brunswick est alimentée par les jeunes adultes, particulièrement ceux âgés de 18 à 30 ans. Et c'est ça qu'on voit dans les régions de Halifax aussi. Et eux, ils ont beaucoup de transmission communautaire. Comme je l'ai mentionné plus tôt cette semaine, plus de la moitié des cas actifs de COVID-19 au Nouveau-Brunswick, à l'heure actuelle, sont des jeunes de moins de 30 ans. Nous sommes particulièrement préoccupés par la façon dont le virus se propage parmi les jeunes du Nouveau-Brunswick. Pour renverser cette tendance à la hausse du nombre d'infections à la COVID-19, il est d'une importance cruciale que les jeunes de la province fassent trois choses: cesser de rassembler en grands groupes, cesser de voyager, particulièrement aux endroits où il y a un nombre élevé de cas dans notre région, et subir un test dès que les symptômes apparaissent. On sait que les gens entre 18 et 30 ans, soit ils n'ont pas des symptômes ou il y a des symptômes très faibles. Et c'est la période juste avant qu'ils développent des symptômes qui sont très contagieux. Alors qu'ils ne savent même pas qu'ils sont à risque à donner le COVID-19 à d'autres gens. Young people are not as likely to become gravely ill from COVID-19, but it does happen. The role they play in this outbreak tends to be as carriers and transmitters of the virus, and they become infected unknowingly, as I said, during that period of contagiousness when they are feeling well. And so they are passing the virus along unknowingly to their elders and other people who may be less able to fight off the effects of COVID-19. And as we've seen in terms of transmission patterns in the outbreak in Zone 5, we saw that the large number of family and friend connections in that area, in that zone, played a huge role in people's mental well-being and the fact that it was really contributing to very healthy and vibrant community connections. But in an outbreak, in a pandemic situation, this tends to work against us. So just as young people gather and want to be with family and friends, gathering in large numbers or in groups of inconsistent close contacts from different events and activities, as this contributes to a vibrant social life and normal activities for that age group, in a pandemic and an outbreak situation, again, this situation works against us. It's only natural to want to socialize in those ways, but it can work against us, and it is not in our best interest during a pandemic. So I urge everyone, especially our young people, to avoid gathering in large numbers. And sometimes it's small numbers, but it's the number of small gatherings that add up. J'exhorte donc tout le monde, mais surtout les jeunes, à cesser de se rassembler en grands groupes ou des petits groupes multiples. Réunissez-vous de façon virtuelle le plus possible. This has been a major contributor to the spread of the virus here and elsewhere in Canada. But as I said, it is happening with people without people knowing, because they are spreading the virus while they are contagious without necessarily having symptoms or having very, very mild symptoms. So it is very important that people get tested at the earliest sign of symptoms. Even if it's a sniffle, a runny nose, a headache, please look at the list online of all the symptoms that you can have that can possibly be COVID-19 and have a very low threshold to get tested. Please reduce your number of close contacts. Hold your gatherings virtually whenever you can. Please don't travel in and out of orange zones, except for essential reasons. And effective midnight tonight, people traveling into New Brunswick, including all of the Atlantic provinces, are required to self-isolate for 14 days unless exempt. And the Premier will speak more about this when he comes up to do his comments and speech. Ne vous rendez pas dans une zone qui est à la phase orange du plan de rétablissement et ne quittez pas une zone qui est à la phase orange, sauf s'il s'agit d'un déplacement essentiel. Évitez les interactions avec les gens qui se sont rendus dans la région de Halifax, sauf si vous portez un masque et maintenez une distance de 2 mètres d'entre eux. Et essentiellement, s'il y a quelqu'un qui vient d'Halifax, il faut qu'il s'isole pendant 2 semaines. Alors moi, je veux pas que les gens auront des interactions avec des gens qui viennent de Nouvelle-Écosse ou n'importe d'autre endroit hors de la province de New Brunswick. It is very important that you be aware of the symptoms of COVID-19. As I said, they are on our website, and please get tested immediately at the first sign of even the mildest of symptoms. You may think it's just the sniffles, as I mentioned, a headache, sore throat, or bad cough, but these are all common symptoms of COVID-19, and no one can afford to take the risk of potentially carrying this virus or spreading it to others, especially vulnerable populations. If you have any of these symptoms, no matter where you are living in New Brunswick, please take the self-assessment test at the Government of New Brunswick website. It's fast and easy. Si vous ressentez n'importe quel de ces symptômes, peu importe où vous habitez au Nouveau-Brunswick, faites l'auto-évaluation en ligne sur le site web du gouvernement du Nouveau-Brunswick. C'est simple et rapide. Testing will be arranged as quickly as possible. I can advise everyone that testing capacity is being increased in both St. John and Fredericton as I speak, and to ensure that bottlenecks do not occur. Young people have been part of the transmission of the current outbreaks in this pandemic, and they also have the power to slow the progress of the disease and protect our vulnerable populations, our schools, our businesses, and our communities. We need all our young people to take this seriously and take actions that will slow the spread of COVID-19. Again, most of the times it's happening without their awareness because they are transmitting while they're contagious but not exhibiting symptoms. So everyone take care of each other, be compassionate and be kind. Thank you. Merci.
Good afternoon. Bonjour. As you just heard from Dr. Russell, the Fredericton region will be going into the yellow-orange zone as of midnight tonight. There are concerns of multiple exposed areas. We've seen certain exposures in schools, in gyms, in pubs, and we're reacting quickly to gain control. As Dr. Russell also affirmed, many of these cases are related to close associations of younger demographics, people with high numbers in very close contacts. Nous sommes préoccupés par le nombre élevé de cas chez les plus jeunes, ce qui inclut des personnes qui ont un nombre élevé de contacts étroits. Community transmission is a real concern in New Brunswick. However, it's very important to identify that at this point in time, our contacts have been traced. Public health have done a super job in identifying where people have had contacts, and now we're waiting as time rolls on to see how many will actually become symptomatic. Thus far, the cases that have been identified, the new cases today, have indeed been predicted as possible COVID-related patients. At this point, community transmission has not been confirmed here, but the threat is real. We've seen it all across our country. We've seen it in every province. We've seen it all around us. So taking swift action right now is important. And that's why, effective midnight tonight, we're resorting back to our original 14 days isolation for anyone from anywhere traveling into New Brunswick to self-isolate for 14 days. And that's effective as of midnight tonight. The normal exemptions will continue. Commercial vehicles, work, business, medical, child custody, child care, all of those areas where we have routine activities every day that's known. Pre-registration is a continued requirement and will be one now from any province, and that obviously is including throughout the Atlantic region. Le risque de transmission communautaire est une véritable menace. C'est pourquoi toutes les personnes qui viennent au Nouveau-Brunswick devront maintenant s'y isoler pendant 14 jours. Et les gens de Nouveau-Brunswick qui voyagent à l'extérieur de la province devront respecter les directives concernant les tests de dépistage et les isolements. Our compliance has been ramped up over the coming days and over the past week. Travelers who haven't been registered are subject to fines. So just as I go through this, I want people to understand that those rules will be enforced, but we're expecting full compliance. In recent days, officers have conducted 426 inspections in Zone 1 and 2. And now, of course, we'll be ramping up our surveillance in Zone 3. 71 fines have been issued, 140 compliance letters to businesses. Peace officers doing community checks. They're responding to any complaints they receive. But I have to point out, because I've heard a number of concerns and comments, about maybe the level of communication and how we communicate that people are in violation. And I just ask that we all be patient, because I know that it's not easy when a peace officer or an officer of any kind comes up and suggests that you're not following the rules and regulations. But it's all for our own good. So let's look past any particular issue and let's look to why our peace officers are being so diligent. They're out there to protect each and every one of us. They're taking the abuse and they're giving the abuse, but it's all part of how do we interact with one another. And as we go through this, we'll be in a position where we'll look back and say, it didn't hurt to provide a little more caution, to be a little more caring, and to ensure that the rules are being followed. And we're so close, as we've said in previous announcements and previous discussions, we're so close. I think there are 5 vaccines now that are being discussed. I'm in a meeting tonight with the Prime Minister. We'll be talking about distribution Canada-wide. We'll be talking about how the vaccines will become available and when they are ready to be on the market. And, it's all part of the strategy to get back to normal. But as I said in other meetings, let's not lose it at the end. So be patient with one another, but be diligent about following the rules. Les agents de l'EPA vont faire des vérifications dans les communautés partout dans la province. Ils vont également répondre à toutes les plaintes qu'ils vont recevoir. If you're concerned about compliance with the state of emergency, you should call 1-844-462-8387 or email helpaid@gnb.ca. We need everyone's eyes watching and helping us all to beat COVID back and to ensure our curve can stay flattened, and that when a vaccine is ready, it's not because we're in a state of emergency, it's because we're ready and we're willing, and our province has been successful throughout this entire epidemic. So clarifications on a mandatory orange. So just so everyone is clear in terms of what does that mean now that the Fredericton zone is in orange, along with St. John, along with Moncton. One household bubble that can extend to caregivers or to individuals outside of the household who require support. We also have clarification on Campobello. Residents can stop at Lubec, Maine for fuel, groceries, or health needs. They can stop in Lubec or Machias, Maine for health needs, and then they can return to New Brunswick without isolating. But we do encourage trips to be kept to a minimum. We encourage all health rules being followed when visiting in Maine, certainly to follow the rules there, but continue to follow the rules that we have, rules that we've known that are effective, that can protect you, and keep your trips to a minimum. Also, another area of issue and of focus for us would be bars and restaurants. Now, we've been following and we've been visiting a lot of places, as I indicated some stats earlier, but it is a known concern. And there's been many people talk about bars being open. We have tried to balance the economy staying open with the reality of living with COVID. And we're asking once again for people's help. So yes, if you go to a bar, you're seated. And the owners of the establishment need to make sure that patrons are staying seated and that they're following the health rules. And they're working within the one bubble now that it's in an orange phase. So it's important that we allow business to operate. And I know there's an economic impact here, and the business owner can make a choice, whether it makes sense to stay open and follow the rules or to close. We're trying to give those options, but not following the rules is not one of the options. Our goal is to keep the economy going as much as possible. is to keep life as normal as possible, but knowing that living in COVID is not normal. We still need to keep the risk low, and we can do that by following all of the public health rules. And that makes us all cognizant about each other's and our own mannerisms and what we're doing out in public. Protecting healthcare system is important. We must ensure that our healthcare system does not become overloaded. And we've seen this in other provinces. And we've been blessed here because we haven't seen that in New Brunswick, and we don't want to see it here. Our healthcare workers have done a super job when the need has been presented. We've talked endlessly about individuals around our province, be it healthcare, be it enforcement, be it lab services, in any area, that have done such a wonderful job at keeping us safe. So let's stay focused. Notre objectif est de continuer à faire tourner l'économie et à vivre nos vies le plus normalement possible, tout en continuant à réduire les risques et à protéger notre système de santé. We can beat this. We can maintain the reputation we've had throughout this pandemic of being right and looked at from all over the country, all over the world, as a place to be. I'm very confident we continue our great record in this pandemic, and I don't want to lose it now, and I'm sure none of you do. So I'm asking everyone in our province, I'm asking our students, I'm asking individuals, be patient, be adherent to the rules, and let's stay number one in our country in beating back COVID. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre, Dr. Russell. Thank you, Premier and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Vous avez le droit de poser vos questions dans la langue de votre choix, et chaque journaliste peut poser une question. We'll now proceed with questions from members of the media. Please ensure your microphones are muted. Each reporter will have one question, and you have the right to pose your question in the language of your choice. John Chillibeck, Daily Gleaner.
Hi, thanks for taking my question. Yesterday, 0 cases were reported in the Fredericton region, and today it's 3. I talked to Horizon Health Network, and they told me that the outbreak at Stan Cassidy seems to be contained. There's no new cases there. So I'm wondering why now is this being imposed orange on Fredericton region, given that there was a bigger case count on the weekend. Were these 3 new cases that bad that there's a fear it might get out of control?
Hi, John. That's a really good question, and we pretty much knew people were going to wonder that. And that's why we have great epidemiologists that we work with and our medical officers to do the risk assessments. So basically, we did make a change in terms of how we're reporting cases. So there were several cases that were affiliated. We've been reporting cases where they have been affiliated with outbreaks or clusters. So in the Zone 5 outbreak, people who were infected and part of those clusters were included in Zone 5 when we reported them. And that was a logistical issue around helping our contact tracing teams, et cetera, in terms of who was following people along. It was really important for our clarity to understand that. So we've just made a change now so that our reporting will include where people, where they're living in terms of where those contacts, where the cases are going to be. So there are a few more cases that happened that are here in Zone 3 that are as a result of exposures and cases in Zone 2. So right now, the rationale for orange alert and recovery, again, from our epidemiology team and our medical officers, there are multiple varied settings of exposure settings, including but not limited to the rehab center, the disability day programs, pubs, gyms, sporting teams, and schools. And when you say that the rehab center outbreak is under control, we will continue to be testing people. People are isolating, they're close contacts, for 14 days. We're going to keep testing staff. We're going to keep testing patients. And then all the other places where we've seen exposures, disability day programs, obviously vulnerable populations, pubs, gyms, sporting teams, and schools. We were also seeing that kind of exposure in Zone 1, and so again, and also in Zone 2. So we know that these are the types of things that can increase case numbers very quickly. So the population interaction between the three major southern cities is significant, and the same demographic, as I mentioned, that's driving the outbreaks in Zone 1 and Zone 2 with high numbers of social interactions in different settings. And, you know, we have over 1,000 people self-isolating around the province right now, and a large number of them are actually in this zone as well. And DPS statistics on mask wearing is 90%, and COVID plan compliance is about 54%. And the lowest compliance was in Zone 3. And again, we've seen this over and over again in the different outbreaks. We start identifying some risks, and then we try to manage those risks, and this is one of the ways that we're doing that. And we did fall into a bit of a backlog in terms of the ability to test and screen, which we are working on, and we are planning to catch up. But to be able to screen and test symptomatic people in a timely manner is really, really important. So, and also, when we presented to Cabinet, again, our epidemiology information, we're looking at, you know, doubling times of cases, and if you look at it on paper, again, we're really informed by the data of the type of transmission that we're seeing, the high number of close contacts in these cases, and we're needing to impose these measures to change the direction that things were heading in.
Thank you, Doctor. Thank you, Mr. Chilbeck. Laura Lyle.
Hi, thank you. This question is for Premier Higgs. I'm wondering, I believe you mentioned that you would be speaking with the Prime Minister tonight about vaccines and vaccine rollouts. When would you like to see New Brunswick get the first round of vaccines?
Well, I guess that's directly related to when they're available. At this point, we don't know that. When we will learn some additional information from the Prime Minister tonight. I think what we'll get tonight is a discussion around the whole rollout criteria and what that could look like across the country and how we can manage that. How we'll discuss areas of how it'll be administered per capita, I think will be a major kind of discussion. And then it'll be one in relation to the vulnerability of different provinces and the vulnerable population that needs to be served first. So, you know, I'd love to think that we'd be in a position to roll out a vaccine in the coming months, maybe talking the first quarter of this year, but I'm not in a position to verify that, and I'm hoping for some good news in that regard tonight.
Thank you, Premier. Thank you, Ms. Lyle. Tim Roselle, Global.
Hi, good afternoon. My question is for Premier Higgs. Mr. Premier, just wondering if you could provide an update on the status of the situation with the Listigouche First Nation students who cannot come into Campbellton to go to school. It seems like both the New Brunswick government and the Quebec government are kind of pointing the fingers at one another for blame as to why this situation persists. Can you provide an update?
Well, I guess maybe it would be appropriate to ask Chief Gray, because in our, you know, we were fully aligned with the chief about getting that community and the kids back into the school system, and the criteria was around the bubble that we would have with his community and with Listigouche, and we had worked out actually a program where the border within Quebec, because it is a Quebec border between his community and the rest of Quebec, would be watched the way we are watching our border between Quebec and New Brunswick. So we had worked out a plan that would be implemented, and that in doing that, his community was protected from outside the region coming in, and we felt it could just be an extension then of the New Brunswick border. So there wasn't any confusion about what it would take in order to get the kids back in school, because that is our mutual objective. However, the Quebec government were unwilling to provide that service at their border. It isn't something we can do on their border. And as a result, what we've done is we have teachers going and working with the students in the Listigouche community. I think there's 5 teachers that are working in that regard and going to the community. So we are keeping up or trying to keep up to provide an educational service. But until that border issue is resolved, it leaves the kids without being able to come as they might normally do so.
Thank you, Premier. Thank you, Mr. Roselle. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce, and thank you, Premier, for the information regarding Campobello. My question today is also for the Premier. Since there's a significant rise in COVID-19 exposure notifications for bars and pubs, as well as the jump in the 18 to 30-year-old demographic testing positive, and since alcohol lowers inhibitions, which would presumably make following COVID-19 rules more challenging, why not close bars earlier or limit the number of drinks patrons are allowed to serve?
So all those factors are consideration in relation to activities. And so what we've seen is that, whether it be at a bar, an establishment, or whether it be at a house party, the exposure exists. And so we're trying to look at where we can actually provide a level of scrutiny, and where not only do we have officers to monitor, but the owners of the establishments will provide a level of scrutiny. We're asking for the same rules apply to these establishments as would apply to any restaurant. And we're asking that in this case, going into Orange, that there actually is a household bubble. So we know that's going to have a big impact on people coming. But at this stage, it's, how well can we control normal activity, knowing that it's not really as normal as it once was. But with the orange phase and a household bubble requirement, we know that's going to limit activity dramatically. And that, we feel, is kind of the best next step right now.
Thank you, Ms. Hogarth. Thank you, Premier. Andrew Watt, Telegraph Journal.
Yeah, hi, thanks. So just want to confirm the Atlantic bubble's kind of over by the sounds of things. And Dr. Russell, can you tell me exactly which two triggers have been met to send Zone 3 back into Orange, please?
So again, I took the advice of our epidemiology team and our medical officers and made recommendations to the COVID cabinet around the risks in the orange phase right now. There are a very large number of close contacts in terms of being able to test and contact trace in a very timely manner. We do have a backlog right now. So again, knowing that we've seen these patterns of transmission in the Halifax region, we've seen it in Zone 1 and in Zone 2, so we know what we're up against right now. And so, again, we've taken these steps based on that data, and that's the rationale. But they also, again, the interaction between the three major cities is a factor. So when the risk assessment was done around the triggers, those are also the things that were taken into consideration.
Thank you. Marie Sutherland, CBC.
Hi, good afternoon. It's been repeatedly said that it's hoped that the outbreaks can be brought under control in zones 1 and 2, Moncton and St. John, within 2 weeks. But Moncton's already just over the 1 week mark, and St. John is closing in on a week. At this point, are you still optimistic these zones will roll back in 2 weeks, or will it likely take longer?
Well, it all depends on how well people comply with the public health measures that we put in place. In the last outbreak in Zone 1, we were able to get it under control within 2 weeks. The outbreak in Zone 5 took 4 weeks to get under control. And just to come back to Andrew Waugh's question about what the triggers were, again, looking at the multiple varied exposure settings, including the rehab center, disability day programs, pubs, gyms, sporting teams, and schools, again, in terms of transmission, that's what we're seeing in Zone 3. And this is the same demographic that we're seeing in Zone 1 and Zone 2, with high numbers of social interactions and settings, high numbers of close contacts. We do have a backlog in the ability to test and screen symptomatic patients in a timely manner, although work is ongoing to address this. The DPS statistics on wearing masks, 90%, and the COVID plan compliance was about 54%, and the lowest is in Zone 3. And the population interaction between the three major southern cities is very significant. And again, what we're seeing across the country in terms of overwhelmed hospital systems, what we're seeing in terms of significant community transmission in the Halifax area. Again, putting the measures in place that we're putting in right now are to protect ourselves from having to go into the red phase in any area of New Brunswick, obviously.
Thank you, Doctor. Thank you, Ms. Sutherland. Natalie Sturgeon, Telegraph-Journal.
Thanks. Bruce, my question is for Dr. Russell. Yesterday, Minister Dorothy Shepherd said the healthcare system was experiencing some staffing shortages, and we know right now from the health authority that in Zone 2, the majority of those seem to be at the St. John Regional Hospital. We know that, as you mentioned, there are more than 1,000 people still self-isolating right now. I'm wondering if you can tell me how many of those may be directly tied to long-term care homes in St. John, and how those staffing shortages are impacting healthcare.
Well, I will just start off by saying that prior to the pandemic, we had human resource issues in our healthcare system. That's not new. And COVID-19 has certainly put extra pressures, not only from having patients who are ill with COVID-19, but also healthcare workers who either test positive or who are close contacts of patients with COVID-19 or other cases. So that's the backdrop of what's happening right now. Certainly in the St. John area, people affiliated with the Shannex, and there were some healthcare workers that were self-isolating, upwards of about 74 in that area. So whether it's a hospital, whether it's long-term care, whether it's in either of those types of settings, that's what we're seeing right now. And that is a large number in a very, small resourced area in terms of healthcare in the first place. So anybody who is off at any time, it makes a big difference. But when you have 74 staff, that is huge.
Thank you, Ms. Sturgeon. Thank you, Dr. Clara Pasica, Times and Transcript.
Good afternoon. My question today is both for Dr. Russell and the Premier. A private company has announced its expansion to New Brunswick to conduct corporate COVID-19 tests, a process which has already begun by the company. Do you see this as a way to help the strained testing system and be proactive, or do you have concerns regarding private testing and recommend corporations and individuals use the provincial testing system?
So we have quite a coordinated lab group that meets regularly along with our infectious disease specialists. So they're having conversations with the lab group is having conversations with private industry around how they best can utilize the point of care testing available right now or whatever systems. So for the time being, we're obviously recommending that they use our system. But if there are other things happening with those, the lab group are the ones who are communicating with them around what the best approach is at this time.
Thank you. Thank you, Doctor. Thank you, Clara. Savannah Odd, Telegraph-Journal.
Hi there. My question is for Dr. Russell. As you know, there's a growing list of possible public exposures in bars and restaurants, but I'm hearing that workers in those settings are waiting nearly a week sometimes for test results, and in some cases they're waiting that long just for an appointment, even for those workers that were on shift during a possible COVID exposure. So why aren't these workers in the bars, restaurants, as well as retail settings, if that's a place where there's a COVID exposure, why aren't they being prioritized in testing, given the amount of people they interact with?
I hear exactly what you're saying. And in terms of our approach at this moment in time, if public health directs somebody to get tested, then they are a priority group. People who are symptomatic get tested ahead of others, and we also have a priority group testing for people who are pre-op, et cetera. So if they are identified as a close contact, then they should be self-isolating at home, so they can't be infecting other people, obviously. And so again, we do have a backlog, which we have been working on, and we were hoping to have it rectified by Friday at the latest. So that's what I can tell you right now, but certainly if you've been contacted by public health, you should be self-isolating again, thereby not being able to contribute to any more transmission. And that's the biggest, most important piece of this. But I do hear what you're saying in terms of people waiting. But asymptomatic people, unless you've been told that you're a close contact, we weren't planning to test those individuals at this time.
Thank you. Sophie Desauters, Radio-Canada.
Oui, bonjour. Ma question est pour le Dr. Russell. Vous avez expliqué que la moitié des cas positifs sont chez la population, les jeunes. Aujourd'hui, vous annoncez que tous les travailleurs, même de l'Atlantique, qui arrivent dans la province, devront subir un test et s'isoler pour 14 jours. Alors, pourquoi avoir cette nouvelle exigence pour les travailleurs? Parce qu'on sait que ça va avoir une conséquence importante sur les entreprises.
Je vais revenir à ta question dans juste une seconde, mais John Chilbeck avait demandé une question au niveau de combien de gens sont en isolation maintenant. Et le nombre en total pour la province, il y a 1700 personnes. There's 1,700 people that are now self-isolating in the province, and 377 of the people self-isolating the province are in Zone 3. Alors, il y a 377 personnes qui sont en auto-isolement dans la Zone 3. On n'a pas changé les règles sur les règles qui étaient en place avant le changement dans les bulles atlantiques. Je sais, j'entends ce que vous dites. Avant que les changements avec les provinces atlantiques, c'était le cas avec les gens qui venaient du Ontario, Québec, les endroits en hors du bulle atlantique. C'est une manière de se faire tester, commencer sur le jour 5 de votre isolation. Et aussi les gens qui viennent des États-Unis, etc., qui sont des travailleurs essentiels. Pour les gens qui travaillent chaque jour, qui vont et viennent chaque jour pour le travail essentiel, ces gens-là vont se faire tester volontairement 2 fois par semaine. Alors, c'est les mêmes règlements qu'on exige qu'on appuie pour les gens qui viennent hors de la bulle atlantique avant que la bulle atlantique n'existe plus. Mais aujourd'hui, à commencement à minuit ce soir, parce qu'il n'y aura plus de bulle atlantique du tout, les gens qui viennent du Nouvelle-Écosse, de Terre-Neuve et aussi de l'île du Prince-Édouard, ils vont se faire tester dans la même façon qu'on fait tester tous les autres individus qui sont des travailleurs essentiels en hors du Nouveau-Brunswick.
Merci, Mademoiselle Desauters. Adam Harris, Telegraph Journal.
Thanks, Bruce. I just came from a federal briefing where officials said that 3 million Canadians will receive the first COVID-19 vaccines within the first 3 months of next year, if regulatory approvals are given. I wanted to know if you expect any of those first doses to come to New Brunswick.
Absolutely, I would. I would guess that when we go through the vulnerable population scenario and look at how that compares across the country, that we would have our proportion. And as I mentioned earlier, I've heard many talk about a per capita sharing, and that'll be the discussion. I would guess that'll dominate the call tonight.
Thank you, Premier. Thank you, Mr. Harris. Erica Butler, CHMA, Sackville.
Hi there. Thank you very much. This is a question for the Premier. I guess I'm wondering what changes we will see at the borders. Especially I'm concerned with the Allac border into Nova Scotia, which hasn't had a checkpoint for some time now. Will that change? What will happen there?
No, we aren't going to put up checkpoints. We're asking for, obviously registration, so we know people are coming and going. We know there's a lot of essential travel that moves back and forth, working in different areas. So we understand all that, so we're not going to impact with that routine work-related and essential travel-related activity. What we want to discourage here is that the need to go back and forth. That could otherwise, there are other options. And we need to know. We want to be able to trace movements because we want to be able to contact individuals should we have a further spread, I guess, of the virus in the area. So this is all about understanding our movements again, but we're not putting the borders up. We're putting our efforts into surveillance in the communities. We'll be, looking for outside cars and people traveling, and we'll want to understand, the reason. We'll want to have them know that they're registered and that they have a valid justification for being in the province.
Thank you, Premier. Thank you, Ms. Butler. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, Mr. Shepard mentioned yesterday that a technical glitch earlier this week had delayed test requests getting through to schedulers, and that a second issue had also caused delays. What caused these issues? How significant were they in terms of the current backlog, and how were they resolved?
Well, one of the technical glitches had to do with fax machines in this zone. I don't know what the second glitch was in terms of technical issues, but I do know one of them had to do with fax machines, and my understanding is that's been resolved.
Do you want to tell her about the increased capacity
Sure.
at St. John?
Yep. And, you know, concurrently, we've been monitoring the risks ever since the outbreaks have started in both of the Moncton zone and the St. John zone. And we've been adjusting our approaches and increasing our testing capacity by putting in a new center in St. John, and also increasing capacity in Fredericton and St. John. So again, we kept seeing the surge in requests and demand, and we're adjusting to meet that surge and meet that demand.
Thank you, Ms. McKinnon. Thank you, Dr. Simon Delattre, l'Acadie Nouvelle.
Oui, une question pour le Premier ministre Higgs. Donc dans la zone orange, depuis Amazon et à Saint-Jean, plusieurs bars ont dû fermer leurs portes en raison des nouvelles non sanitaires, mais également de la situation. Et pour les restaurants, également, la bulle d'un ménage réduit fortement la fréquentation. Et plusieurs craignent les conséquences économiques là, pour ces deux secteurs-là. Est-ce que votre gouvernement considère une aide ciblée pour le secteur de la restauration, le secteur des bars au Brunswick?
Yes, I realize this has can have a significant impact, and that's why we've been trying so hard to keep business open. But I understand it's going to reduce the number of certainly patrons that will be coming to the establishment. So we are looking at the impacts financially. I've asked all businesses, to contact our navigators line so we can understand directly the impacts. We're trying to work through this in the province. Thus far, our statistics have been good in terms of businesses starting up and operating. We've been consistent in being allowing that to happen. But I do want to understand what it means so that in real terms, I don't want to see multiple business closures and not being able to get started up and run again. So I want to assess the impacts and be able to react accordingly.
Merci, Monsieur Delattre. Merci, Monsieur le Premier ministre. Marie-Ève Brassard, Radio-Canada.
Merci. Oui, donc ma question est pour Dr. Russell. Donc, dans la péninsule acadienne, il y a beaucoup de résidences pour personnes âgées qui interdisent maintenant des visites. Il y a des organismes aussi qui ont annulé leurs activités ou qui les ont reportées. Donc, est-ce que vous êtes en mesure maintenant de nous confirmer qu'il y a un cas de COVID dans la péninsule acadienne entre Grand-Anse et Néguac?
Tu veux savoir si moi je suis au courant s'il y en a des cas?
Oui.
Les seuls cas que je suis au courant, ce sont ceux-là que j'ai rapportés aujourd'hui dans chaque zone que j'avais lu tantôt durant mon rapportage.
Even if there was a case, you can't confirm
Okay,
the location. OK, merci.
That concludes today's COVID-19 news conference with Premier Higgs and Dr. Jennifer Russell. Just for a recap, there were 12 new cases of COVID-19 in New Brunswick today. 8 of those were in the St. John region, 3 were in the Fredericton region, and 1 was in the Moncton region. And as of midnight tonight, the Fredericton region, that's Zone 3, will roll back as well to the orange level of recovery, which means Zones 1, 2 and 3 are all now in the orange level of recovery. Good news for people on Campobello. We heard from the Premier today that you are now able, if you live on Campobello, to acquire essential goods in the closest community, which is Lubec, Maine. I'll be doing a news release on this later today, so look out for that, but that's great news for Campobello. We also heard today that 71 fines have been given out to people for non-compliance, and another 140 warning tickets have been issued. We will be back with you again likely tomorrow.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.